Hello, viewers. You might have heard about stage 1 to stage 4 cancers, and you might be fed about what about a stage 4 cancer? Can we cure this? Or a stage 1 cancer easily manageable? From an integrative oncology perspective, we also have 4 different stages, but not the stage 1 to stage 4, what you normally hear from your conventional medical oncologist. Here, the stage 1 means what changes inside the body. From a genetic perspective, it is like the exposure to carcinogens. It can be your cell phone towers, it can be tobacco chewing, it can be heavy metals around you, or it can be a virus like human papilloma virus, which constantly change and make the DNA to damage. When the DNA damage is happening, the cells start replicating, the cells started growing uncontrollably. But initial stage, we cannot find it. But parallelly, what happens at the same stage, we can also see that there is the mitochondrial dysfunction. The stress to the mitochondria starts, your metabolism starts changing. There can be a constant oxidative stress which can happen inside the body. Whether the mitochondrial stress starts again in the first place or whether the genetic change starts in the first place, we cannot comment on it. It can be mutually exclusive of each other or it can be inclusive of each other. This is the first stage, which is called as the tumor initiation stage or the genetic change stage. Now the second stage, it is called as the promotion stage. From a genetic perspective, the cells start triggering uncontrolled growth because of the DNA replication. DNA does not have any control. Cells started increasing additionally. But how it happens, it is not just because of the genes. Without the support of metabolism, the promotion of cancer cannot happen. There is a metabolic switch which happens within the cells. That means it is called as Warburg effect. From oxidative phosphorylation, a process with the energy is produced inside the cell, it chooses something called glycolysis. That means it starts producing a lot of pyruvic acids inside the body. The lactic acid metabolism happens in the body. This serves as the building block for the replication. That is the overgrowth, the extensive growth of cells inside the body. Now we can talk about the third stage. It is called the tumor progression stage. What happens? The cells almost lost the entire control over how it is proliferating. Multiple mutational pathways come and contribute to the cell's growth, and it starts all the tumor suppressor genes inside our body like P53 and all these lose its way. It cannot come and suppress the body. From a metabolic perspective, what will happen? The establishment of mitochondrial dysfunction starts inside the body. The cell starts using glutamine for its progression. The cells almost, the oxidative phosphorylation is almost lost inside the body. The tumor microenvironment becomes more hypoxic and acidic, which helps to rapid proliferation, that distant stage invasion. It can go to a different cells. It can damage the nearby cells and make the nearby cells cancerous. So this is the third stage, which is called tumor proliferation stage. And here comes the final stage, which is called as tumor invasion stage. That means the cell is almost resistant to any apoptotic signals. That means nothing can kill the cancer cells. It starts complete plasticity against everything. The tumor gains the proliferative potential. That means it can start invading to the other organs inside the body. The tumor starts developing its own blood supply, which is called angiogenesis. And then what happens from a metabolic perspective? The cancer develops metabolic plasticity. That is where we always call it as whatever you give, like we restrict the patient from a certain type of diet. But at times it does not work because metabolic plasticity means the cancer can shift easily from an oxidative phosphorylation versus the glycolytic cycle. It can easily convert and switch between from a protein metabolism to a carbohydrate metabolism. And it helps the cancer cell to evade and progress. So when you heard about all these 4 stages, what it is summating to us, you cannot just mute certain genes and get rid of cancer. Or you cannot just correct your diet and you can get rid of cancer. It should work hand in hand, and it needs really a great and a long length and breadth of work if at all you really want to get rid of cancer. So these are the 4 stages which we consider. And depending upon where the patient is coming with us, whether it is in a tumor proliferation stage or just the genetic damage stage, the treatments and the length of the treatment and the impact of treatment differs from patient to patient. But all these 4 stages are definitely reversible in 60 to 70% of patients. So cancer is nothing like to be scared of. It needs courage to beat it up, and it requires expertise from multiple fields for conquering it. And let us do it together and stay healthy, stay happy. Visit us for more such informative videos on cancer biology and evidence-based integrative medicine approaches for healing cancer.